That there is a false sense of morality at the heart of the problem. Do you think that there's a view that people, when they descend into drug addiction, that this is an indulgence or a weakness, and this is perhaps also something that's not tolerated in a neoliberal society?
I think absolutely there's just overtones of moralism everywhere. You know, people believe that, you know, you're making bad decisions or bad choices, and you're making, you know, this it's just, you know, the tones of moralism are just really stupid now that we have neuroscience that tells us that this is a brain disease, and it's also, you know, you've got a genetic predisposition in the same way that you would have to breast cancer, for instance, you know, and it's just, you need the right environment for it to manifest. So either there's still massive moral overtones. There's also really, really polarizing ideology around this condition. So, you know, you have social workers who believe it's a behavioural condition. You know, they're taught as part of their profession that it's a learned behaviour. You know, and to some extent that's true. You know, I'm Irish Catholic. I grew up in a family where, you know, in the 70s, where all the men were either at bookies or in the pub, they were holding back in their wages. The women were all fucking, you know, sharing oxos with each other to try and put a dinner together. Do you know what I mean? There is a lot to be said for learned behaviour. You know, like when I did get clean and sober, it was a complete shock to me that the rest of the world didn't drink and use drugs to oblivion. Do you know what I mean? That was completely normalised within my environment. But so and there's other professions that, you know, as I said, the neuroscientists are, so the neuroscientists, you know, they now know that it's a brain disease, you know, that our brain circuitry gets hijacked. Like, there's no sense of control or choice once you become physically or even mentally addicted. You know, it doesn't have to be a physical addiction. It can be an obsessive, and quite often that is the two components of any addiction. It's obsession of the mind that tells you that's the solution, whatever it is: booze, drugs, shopping, porn, cigarettes, you know, chocolate, you know, that's the solution. And the obsession continually tells you that lie. And then compulsion, whereby you know, once you take the first, I mean, one of the things that we highlight to people when we're asked about the moral question is, I say, you know, if we're in a room full of social workers or whatever, teachers, I say to them, how many keep chocolate biscuits in the house? And you'll see half of the room goes up, and I say, well, see the other half, why do you not keep chocolate biscuits in the house? And say, well, once I start, I can't stop. So there's this physical compulsion kicks in once you have put the first one in, and it's exactly the same for any addiction, you know. So you know, the choice rhetoric is it's actually laughable. If it was, you know, nobody grows up, nobody wants to be an addict when they grow up. Do you know what I mean? It's really it's an anathema. I'm just like, are we still even discussing that? That's mental. Do you know what I mean? Nobody in the right mind would choose this condition. It's horrendous. And in fact, I think if people actually understood this condition and the mental element of this condition, they would be horrified. You know, even after 23 years, I don't crave alcohol or drugs anymore, but the mental side of this illness can really floor me. So there's a lot more to this condition than just using drugs. And I think our understanding as a society is embryonic of this condition. And I think history will judge us very, very harshly for how we treat people with addictive or substance use disorders.
This idea of, you know, people playing Russian roulette with their lives that you talked about at the beginning as well. You know, I find that really upsetting, that people can find life so uncomfortable that they can do that. And you know, obviously things like ACE, adverse childhood experiences, play into that as well. Would you like to add anything to that?
the question, I think, around, what is it about people's lives that is so horrendous that they're willing to take their chances with these street value, right? So you get into any community in Glasgow and you can buy, or any poor community rather, and you can buy these street value for 20 pence, right? A can of super lagers, like 150, I think, is it? I don't know, it's been a long time since I've bought anything like that, but when you compare it even to booze, right, it's so cheap, right? So all you need is one or two of these to get out your nut. That's 40 pence to get out your nut, right? But everybody in, these communities knows that you're playing Russian roulette. That they've, like I said, like we're burying thousands and thousands of people every year. The official statistics last year said 1,200, but I know we've buried 1,200 since COVID easy in Glasgow alone, never mind anywhere else. So what is it about people's lives that they're just like, and excuse me for swearing, but they're just saying fuck it. Do you know what I mean? They're saying fuck it. What is it that's so terrible? And I think, we've had, what is it, it's over a decade now, this austerity nonsense, and unemployment has risen, and the benefit system is so difficult to manage and navigate, even reaching out for any sort of help. You need to be a mental health ninja to get to work your way through that system. Do you know what I mean? So I think we really need to ask ourselves as a society, what is so wrong, and why are we in so much despair that we're willing to do that, to kill ourselves, take our chance?
We've got Simon McLean, who is an ex-police officer, and Simon is with LEAP Scotland. So first of all, Simon, can I ask you what LEAP stands for?
The LEAP is a Law Enforcement Action Partnership.
I had a really interesting conversation with Simon a few weeks ago, and your experience as a police officer has taught you that the way that we're going with this is just nonsensical. Can you elaborate on that?
Yes, of course. Can you hear me now?
Yes, I can hear you perfectly.
Fantastic. I like to do that at the start just to show that anybody can become an activist. You don't need to be very clever or work a computer very well. Thanks, Kieran, and I'm glad to be here at last, and thanks for the invite. The thing I was going to say about activism, the discussion, and I could listen to this all night. I was hoping you'd forget about me and I could just listen to the stuff you're talking about, because it's all an education for me, because I'm quite new to this in the last 8 months or so. And we only started LEAP Scotland in January of this year. So we're very much a new organisation, but I think called for, because we're basically retired and serving, more and more serving police officers every day joining us, who all agree that this war on drugs is a nonsense.
Yes, absolutely, yes. So I had a question for you earlier as well about the prison population. And, it was quite shocking to me how many people in the prison population are really drug users. What can you tell us about that, Simon?
The thing that immediately comes to mind is something that we speak about regularly, is that it's much more expensive to keep people there and expose them to all the other forms of crime that they get educated on in there. And it would be to rehabilitate them and provide proper services for people, health services that could help people address these issues properly with counselling and rehabilitation and all the things that we know about that can help people make better life choices. So the prisons are run by the prisoners, really, and I know that from first-hand experience. And the way that they're appeased and the way that it runs is on a mutual basis of understanding with the authorities that run the prison service, the Scottish Prison Service, and it wouldn't run without the say-so of the prisoners. And that's the way it's appeased, is because drugs are readily available of any description inside the prison walls. And if we can't keep them out of prisons, which we keep saying we're trying to do, how on earth can we keep them out of the country or out of our communities or out of the actual streets that we all live in?
Yes, yeah. You must be very frustrated at just the destruction and the nonsensicalness of this. What can LEAP Scotland do about this?
Well, we're doing lots just now. And it's really that active thing that I wanted to speak to you about. Our chairman, Jim Duffy, has been doing this for 15 years now. when he was a serving police officer. He was an inspector and chairman of the Scottish Police Federation before he retired. And he goes round, not obviously in today's climate, but we hope to continue with his work going round tables and Lions clubs and the Rotary and that kind of thing, doing talks, maybe 20, 25, 30 people at a time. But Jim tells a story that every time when he starts off the presentation that we do, which we can do in 2 or 3 minutes because it's not complicated, that he does a straw poll, Kieran, and asks people what they think of decriminalisation of drugs. And invariably with that middle class audience, he maybe gets 1 or 2 that tentatively agree that we should decriminalise. And that's pretty much par for the course. My point is that what we're talking about here is coming to the degree of common sense now. And what we need to do is numbers. Just like Annemarie says, we need to get the message out on websites. We need to do it collectively. That's why the partnership there is part of LEAP. Because as Jim says, at the end of his presentation, before he gets his meal and his wee dram, of course, he does another straw poll. And invariably, it's reversed completely. And you're lucky if there's 1 or 2 that still think that decriminalisation is a bad idea. Because basically what LEAP would like to see, in association with all of the partners that we have, and we're working very closely with Transform and Anyone's Child that Annemarie mentioned earlier, Release and Drug Science, and hundreds of organisations globally. We have an event this Monday about trauma awareness, and next April we've got an international event with police officers from Canada, Belgium, Scandinavia, coming to tell us how things are working in their countries, because there really is a momentum just now and where we're headed. And our basic principle, I suppose, is that drugs aren't illegal because they're dangerous. Drugs are dangerous because they're illegal.
Well, there has been a poll tonight and 100% of our attendees have said that drugs should be decriminalised. So I hope that heartens you, Simon.
I was only speaking for 2 minutes as well. That's amazing. I can tell Jim Duffy it works.
Yeah, it's fantastic. And you know, for me, it was so heartening to hear your story as a police officer. And also what was interesting as well was you were saying that during your time when you were working, you understood that what you were doing when you were busting drug dealers was actually making the problem worse.
Yeah. There's a perception that that the war on drugs and police activity and whatnot is a negative thing. And it's not a negative thing, but it's not doing any good. I would go much, much further than that. The actual truth of the matter is, and the question I would like to hear asked when you have senior police officers on TV and whatever forum stating that they've just made a big drugs bust and £100 million worth of this or that has been recovered, I'd love someone to ask them, what do you think the effect of that is going to be today? What do you think you've just achieved? Because we know, you and I know, and 100% of the people that are on here tonight know that all of the effects are negative as far as our communities are concerned. None of it is positive, and they haven't stopped any drug supply whatsoever. It used to be in the 70s and 80s, I could close Govan down for drugs for maybe a couple of days with really close attention and activity. Nobody could do that now for 20 minutes because of communications and the systems that organised crime have in place to keep the supply flowing. Nobody's going to go without their drug of choice because the police make an arrest or a seizure. That is total rhetoric, and we let them away with it time and time again. But the good news is that we're starting to see chinks in that armour, and we now have very senior police officers who might not be ready to come out publicly and say that this is the way to go, but they're already making moves within their own channels to do that.
The war on drugs is the perfect storm for an increase in drug use, isn't it?
Yeah. Listen, we've been speaking tonight a lot about lived experience, and I'm very much involved in that just now in learning about it, because I come from the other side of the fence, really. Although I was brought up in an alcoholic family with all the dysfunctions that entailed. But I'm very much about lived experience just now. And what dawned on me prior to coming on here was the people with lived experience that we don't talk about necessarily. You know, the other people with lived experience. and they can, and they involve a whole spectrum of society that we forget the consequences of this war on drugs for. I'm talking about the estimated 50,000 children who are abused as county line runners in England and Wales that we know of. And this is a very real child protection issue here in Scotland too. The decent people living in our prisons due to low-level drug abuse or drug use and petty crime that's associated with addiction. And that one we've already covered to some degree. All of the victims of violent crime, such as armed robbers, people trafficking, prostitution, modern slavery, and the sex industry, all of these people are suffering, not simply because of the war on drugs, but it's a big, big driver and a big financer of a thing that we call organised crime. All of our communities where money laundering are rife, basically all of the countless victims of organised crime. And this is a multi-billion-pound industry that's raging all around us. And it's underpinned by these laws that ensure that it's stoked by the very people that we trust to fight against it, the police. Because every time they take what they consider positive action, they simply stoke the fire. And of course, we're all affected by the threat of global terrorism, vastly funded by the rewards in office of those perpetuating this illegal drugs industry. And the other people with lived experience that I can vouch for firsthand are the coppers on the streets and the enforcement agencies who risk their lives day and daily, and all they're doing is digging the hole deeper and deeper. These are all victims of our current attitudes, and these are the realities of their lived experiences, although it's not very pleasant to hear or to think about.
I think it's incredibly important that you've come on tonight and talk about this, Simon. I've got a question for both of you now. So can I ask the panel, how will drug, I'll start with Annemarie perhaps. Can I ask the panel, how will drug regulation protect the most vulnerable who are at the highest risk of harm and developing addiction problems?
Well, I don't know if it will. You know, especially the cohort that we're talking about here, you know, the people who are most at risk. So I don't know if any sort of regulation or decriminalisation would protect those people. I think there's lots of areas where decriminalisation or legalisation can be really useful, but when it comes to people wanting to escape their own circumstances, their own head or their own pain, I don't know if regulation or decriminalisation would prevent that. You know, ever since man first started crushing grapes, human beings have wanted to, you know, remove themselves from reality. But in particular, when it's around, you know, trauma, for instance, there's a certain depth of oblivion required when we look at the evidence around ACEs, you know, adverse childhood experiences. For me, certainly being a survivor of sexual abuse and physical abuse and neglect, I'm always sort of not minimising it, but you know, there was a tremendous amount of abuse took place. Do you know what I mean? So for me, the end game was, you know, for using drugs was about self-soothing. You know,
yes.
it was a compulsive self-soothing behaviour. So I don't think decriminalisation would have helped that, or legalisation, or even regulation would have helped that. I would have still been looking for an end or an out for my pain. Where it would come in helpful though is in terms of when I got into trouble, and then we can talk about the taxes that can be used to fuel the treatment system and used to, you know, come back in then. But it would certainly help the public purse, that's for sure.
I agree with Annemarie 100% that without, that's the third tier of what LEAP is about, is that those services and the recognition of why people use drugs in the first place. It's not because of something in their head that's not wired right. It's because of their experiences of poverty and their upbringing and the circumstances that they've been thrust into through no fault of their own. But that's the third part of what LEAP is all about. And we hand that over gladly to all the partners like Annemarie's organisation and Peter Krykant and Kevin and all these people that have got much more knowledge than we'll ever have of those issues. But what I can say is this. We spoke about gambling early on, and it has become regulated only since the 1950s. And until then, people who did have gambling problems, because it's naive in its entirety to think that people didn't have these problems before we addressed them. Now there are safeguards in place. I'm not saying that they work or that they're perfect, but we're beginning to recognise that we can help people who identify as having particular issues in their lives. And that, for us, is what decriminalisation, not legalisation, we're not talking about a free-for-all, we're talking about moving this into the realm of health, away from crime, where people can get the help and resources. Secondly, the regulation, which for me is the big one, because already every aspect of our lives is regulated, down to the air that we breathe, the broadcast that we're making tonight, the radios that we listen to, the newspapers we read, the cigarettes we smoke, you name it, everything that we can consume through our ears, eyes, our mouth, our nose is regulated, but drugs aren't. And that's a deliberate ploy not to do that in order that people can be stigmatized and used as scapegoats in our society. Regulation would allow us to regulate each individual drug to its own tier. So it might well be that cannabis can be accessed like an off sales within specific hours with age groups of obviously 21 or whatever we choose it to be, right up to opioid use, which might be on prescription and might be in controlled circumstances, like Peter again is trying to provide for people. And that regulation, I'm not saying it's going to solve all our problems, because it's a three-tier. They all work hand in hand. But when someone presents for the drug, then we can signpost them towards the resources that must be put in place to give counselling or advice or a simple warning that you get in a cigarette packet. You certainly don't get that in a tenner bag in the streets of Glasgow, I can assure you.
One of the things that we saw from the research that came out of Portugal, you know, and you know, the Portuguese model as it's portrayed, you know, it's a wee bit like Rorschach's inkblot. You know, you can see there what you want to see. You know, the research isn't conclusive in a lot of areas, but one of the things that was very obvious was when they did go to decriminalisation, there was a spike in people coming forward. In fact, it was a 15% spike in people coming forward for treatment. Now, currently, our drug services and alcohol services are not fit for purpose. And if there was 15% of, you know, the Scottish population to come forward for help, that would be catastrophic. Do you know what I mean? To our current system as it stands today. So I always offer caution. I know that there's, you know, people who are, you know, quite, you know, advanced in their thought, and I love the work of Transform. I love the regulation idea, but I always have to come in and say whenever we get into this conversation that currently our treatment system couldn't cope with decriminalisation. It's no fit for purpose. Yeah. So, you know, we've got a lot of work to do, a lot of conversations to have, and it's not as simple as what people might, you know, think it is on an infographic on Facebook or on Twitter. It's just no, you know, that there's a lot of dangers here as well. I would like us to be more nuanced and more cautious in our discussion rather than saying we need to do this, you know, all the way.
I'd like to thank both of you and all of our other speakers as well for this evening. I have been massively enlightened, and I hope that everyone else has as well. And I'd also like